over 5 million people in America have tested positive for COVID-19. Medical experts seen the main solution.
We're not going to get there without a vaccine.
Once there is a vaccine, the next question is who will be the first to get it?
The highest priority groups, certainly at the beginning, are going to be healthcare workers and people who have direct COVID exposure.
Dr. Chris Beyer suggests a good starting point for answers is to look at distribution patterns from other vaccines. He's the senior scientific liaison for the COVID-19 Prevention Network, a federal advisory panel providing recommendations to the CDC.
There's a long way to go before the distribution and access issues, and that plan is very much underdeveloped.
The CDC's Advisory Committee on Immunization Practices suggests a 5-tier plan that was also used for the influenza vaccine. In Tier 1, we have critical healthcare, law enforcement, and public healthcare professionals. Tier 2, groups in the Homeland and National Security category. Tier 3, essential workers. Tier 4, high-risk adults, those 65 years old and older. Lastly, Tier 5, the general population. Another plan comes from the World Health Organization, which laid out a global allocation framework giving priority to number 1, 50 million healthcare system workers, number 2, 650 million adults, 65 years old and older, number 3, 1,150 million high-risk adults.
This is a long process, but at least for studying the vaccine, what I understand is the age groupings are doing well, but they're not doing as well as they'd like with the racial and ethnic minorities.
Dr. Yvonne Maldonado is leading the COVID-19 clinical efforts at Stanford Medicine. She believes distribution could be impacted by the number of COVID-19 vaccines developed.
I would say, depending on which ones come out, if there's more than one at the same time, there might be more numbers of doses available.
Now, whenever a COVID-19 vaccine does roll out, all experts agree on one thing: there won't be enough to go around at first. In May, President Donald Trump announced
Operation Warp Speed,
a federal program aiming to deliver 300 million doses of a safe, effective vaccine for COVID-19 by January 2021. Deputy Director Dr. Julie Ledgerwood gave some insight as to whom they're targeting in the vaccine trials.
As these trials are seeking to enroll volunteers from diverse populations, including minority populations at higher risk of COVID.
A population that, according to John Jacobo with the Latino Task Force, is apprehensive about a vaccine.
So there is some sort of concern I'm hearing from you of those essential workers, minorities feeling like the guinea pigs.
That's right. That's right. And we heard that when we came in the first time to do our testing with UCSF back in April. We absolutely heard people say, we don't want to get tested, and then we're going to be the ones that we're going to be the guinea pigs for potential vaccines to test them out. And we assured them that that's not the case. It's up to individuals to make the choice that seems right and feels right for them.
Latinos, Blacks, and Native Americans have been disproportionately affected by this virus, making race also a main deciding factor when choosing subjects.
Everybody has really been very clear that they want this racial and ethnic distribution to be taken into strong consideration. So we're hoping that that will happen.
For now, hope is what's keeping the world's top experts working around the clock. Hope to find a vaccine and hope for an equitable distribution. Meanwhile, the World Health Organization announced it will have a finalized allocation plan by the end of this month, with or without a vaccine. In San Francisco, Luz Peña, ABC 7 News.